Welcome everyone to our first webinar on addressing health disparities in central nervous systems disorders. Obviously, as most of you are quite well aware, health disparities in the US are a longstanding issue. And, despite a lot of the increased attention in the past decades to this topic, they're still narrowing the health gaps among historically underrepresented and minoritized populations is still not evident in many of the outcomes. And for CNS disorders, this is extremely important, and we know that this is a critical public health issue. And so we thank the National Academies for really giving us this platform to bring this topic to the forefront. So today, this is the beginning of 3 webinars. And this workshop series, the objectives really, as you see here, is really how do we, to look at this perspective of disparities in CNS disorders from many different levels. One, is to review the current state of knowledge regarding health disparities in CNS disorders and the evidence needed to really address the gaps in understanding, including in areas of undervalued and neglected as a reflection in the current makeup of the neuroscience research workforce. We also want to explore available evidence on the impact of psychosocial and environmental factors on CNS disorders and how they contribute to health disparities. Importantly, we really want to consider models of research approaches and other models that are designed to actually enable better inclusion of underrepresented and excluded populations throughout the entire research and development trajectory for CNS disorders to really start building and generating more robust, generalizable, and equitable findings and highlight case studies when possible and the available evidence for their effectiveness. And a major part of all of this, in terms of as we begin to explore potential multidisciplinary collaborations, here we talked about, for example, between basic mechanistic science, cognitive neuropsychology, epidemiology, and technology development to further elucidate these topics and rigorously combine the methods in their respective fields. And by doing that, we hope that we will be able to start moving forward with new approaches to address this topic. Next slide. So we have this webinar series, this workshop series. There's 3 parts. The first will focus on structural and social determinants of risk, and that obviously is today. So thank you again for joining us. But it's the beginning of where we want to go. So the second workshop is going to talk about disparities in access to care, and that will be April 18th. And then we want to finalize in how do we move forward to drive transformative change. And that is really critical. And that will be April 25th. So today we begin with structural and social determinants of risk, and I'll pass it over to John to give more details and to introduce our keynote speaker to start.
Thank you, Yasmin. And let me just say what a tremendous pleasure it has been to co-chair this planning committee with Yasmin and the wonderful members of the planning committee that you see listed here. We've been meeting on, it seems, numerous times to try to organize a truly novel and impactful series of symposia, and I'm very excited about the session today, and as I am about the upcoming 2 sessions. And I also want to say that I'm here on behalf of the Planning Committee, but also as co-chair of the Forum on Neuroscience and Nervous System Disorders, which is the sponsoring component of the National Academies for the 3 sessions. We can go to the next slide. Before I introduce our keynote speaker, I do want to just say a little bit about the outline of the session today. After our keynote address, there will be 2 sessions, and each session, the first session is called Neighborhood and Built Environment and is chaired by Dr. Jennifer Manley. And the second session, which will follow that, is called Social and Community Context and is chaired by Dr. Liliana Amezcua. And in each session, we have 4 to 5 participants who will speak very briefly about the topics of primary interest to them. There'll be then a moderated discussion where participants in this session who are participating virtually will have a chance to join in and contribute to the Q&A. So the intention is for the discussions to be relatively informal and open, and I'm confident that they will be lively and generate a lot of new ideas.